Hi guys, so today I'll be sharing with you how you can memorize the different coagulation tests, kung ano yung mga deficiencies na dinidetect nila, and also the normal values. So the first one is your prothrombin time or your PT. So you know yung bus terminal, diba? The PTEX. Okay, so you have PTEX, magbabayad ka ng 10 pesos. So PTEX, P10. That X stands for your extrinsic factor deficiency, whereas your P10, that would be your normal value, which is your 10 to 12 seconds. If extrinsic, see prothrombin time, then your APTT would be your intrinsic factor deficiency. By the way, both of them, both PT and APTT, detect common factor deficiency. Kaya, if they are both prolonged, so both PT and APTT are prolonged, that means we are looking at a common factor deficiency. But, for example, if PT lang yung prolonged and your APTT is normal, that means we're looking at your extrinsic factor deficiency and vice versa. So, if APTT lang ang prolonged, that would means we're looking at your intrinsic factor deficiency. May isa pa akong mnemonics na nakita sa Twitter, that would be your hapet sa puwet. So, APTT, okay, APTT, which is your test, detects your intrinsic factor deficiency, which is the I here, and it monitors your H, which is your heparin therapy. Whereas yung puwet naman, you have your PT, okay, which detects your extrinsic factor deficiency, which monitors your W, which is your warfarin therapy. So, yun lang yun. And then, take note na yung APTT mo, it has 4 letters, okay? So, you have to test it within 4 hours, whereas your PT, 2 letters to 24 hours, 24 hours. And also take note for the normal values naman. So we have mentioned kanina, 10 to 12 si prothrombin time. Mas onti yung letters, diba? PT, 2 letters lang siya. Your APTT, longer letters or more letters. So mas mahaba din yung normal value niya. So around times 2 siya. Hindi naman exactly, but around. So that would be your 25 to 35 seconds. By the way, in the board exam, hindi naman exact numbers yung i-represent nila. I remember in our exam, ang tinanong dito is for your APTT, and yung nasa choices is I think 20 to 40 seconds. So just take note of the range, kung ano yung pinakamalapit dun sa range na memorize nyo right here. So next naman tayo is your thrombin time. Take note, your TR or your RT, which is your thrombin time, and your reptilase time, they both detect your fibrinogen deficiency. The difference between the two lang is that yung isa, they are affected by your heparin, whereas your reptilase time is not affected by heparin. One way you can memorize the normal values is that, take note, TT, right? Thrombin time, that would be T for 10, the first T. And then yung other naman, that make the first T like a 1, and then the other T, which is like a 4. So 10 to 14 seconds. And then since almost the same naman yung function nitong dalawa, as you can see, medyo magkalapit din yung normal values niya. Maglagay ka lang ng +1. So that would be 10 to 15 seconds. Next is your Stypven time. This one is for your common factor deficiency, and how you can memorize the normal values is that ST. So that will be S for 6, and then T for 10. So 6 to 10 seconds. Then last one is your 5-molar urea. So 5-molar urea, this detects your factor 13 deficiency. And itong factor 13 deficiency is quite unique kasi lahat ng coagulation factors are normal. So PT, APTT, thrombin time, they're all normal. But the only abnormal test would be nga your 5-molar urea. And to understand this is that ano ba yung function ni factor 13? Diba yung factor 13 mo, it is the one that is responsible for stabilizing your fibrin clot. Kaya, if a patient has your factor 13 deficiency, the clot becomes soluble within 24 hours. Pero normally, if the patient has an adequate amount of factor 13 in their bodies, then the clot should be insoluble within 24 hours. So, yun lang naman. So, if you have this memorized in your head, like this whole table, madami na kayo masasagutan sa board exam kasi there are quite a few questions regarding these coagulation tests and also yung mga mixing studies as well. So, take note of that. So, yun lang. Bye!